A piece of paper with dent writing on both sides, setting out your thoughts and feelings, was found in the first search of your home in 2018. Amongst the phrases you wrote were, "The world is better off without me," and "I am evil, I did this."
Suspicion stemmed in June of 2016 when lead doctor Stephen Brewery began to notice an unexpected number of deaths in the neonatal unit of the Countess of Chester Hospital. Something was drastically wrong. During the spree of deaths, one common denominator existed in all of these cases. The nurse of these babies was Lucy Letby. While it is not clear why she committed the reprehensible actions, there are a few elements from her words, as well as words from others who have met her, to draw a psychological assessment of possible motives behind the murders. Letby appears to be narcissistic, particularly in the realm of having a God complex. The concept of having a God complex when it comes to narcissism was originated by Ernest Jones in the early 1900s. Jones stated regarding this psychological conclusion, "The inductive generalizations arrived at on the basis of my observations do not altogether coincide with those that might have been expected from deductive consideration of the attributes popularly ascribed to God. A main distinction between them, for instance, is this. Whereas the aspect of God as the creator is perhaps the most impressive in the ordinary mind, as illustrated by the conclusiveness with which the existence of God is commonly held to be settled by the question, who else could have created the world? Or by more abstract ratiocinations about the necessity for a first cause. This aspect is far from being either the most prominent or the most typical to be represented amongst the fantasies belonging to a God complex. The most striking and characteristic of these would seem to be the ones related to effective power in the broadest sense, omnipotence, and most of the external manifestations of the complex can best be stated in terms of this. In my experience, the main foundation of the complex is to be discovered in a colossal narcissism, and this I regard as the most typical feature of the personalities in question. All the characters' traits presently to be described can either be directly derived from narcissism or else in the closest connection with it. Excessive narcissism leads inevitably to an excessive admiration for and confidence in one's own powers, knowledge, and qualities, both physical and mental. Those with a God complex were seen by Jones as aloof, inaccessible, self-admiring, self-important, overconfident, exhibitionistic, and with fantasies of omnipotence and omniscience. People who operate this way usually have a particular view of self and about others. Regarding beliefs about self, those who have a God complex believe in their own greatness and see themselves as superior on agenic traits, or traits that pertain to self-assertion and independence, such as confidence and intelligence. However, they oftentimes do not see themselves as superior on communal traits or traits associated with caring for other people, such as warmth and kindness. While those with high self-esteem believe they are worthy, but do not consider themselves superior to others, those with low self-esteem believe they are interpersonally attractive when others do not think so. Regarding their view of others, there is a common thread of people with this type of personality looking down on people with the thought that they are subservient to them. sometimes even to the point of dehumanization. However, they also covet others' admiration and crave it so much that they suffer withdrawal symptoms if it is withheld. Since a nurse is oftentimes viewed as a caring, angelic like female servant of God, the trust that patients as well as their family and friends have towards people in this profession is high. As a result, the ability for medical professionals to perceive themselves as having divine power of life and death is more tempting. However, it also gives a nurse the ability to take personal emotional instabilities out on vulnerable patients. Letby's forms of murdering the babies were administering milk into their stomach via nasogastric tubes, adding insulin to intravenous feeds, as well as injecting air into their bloodstreams, which puts pressure on the diaphragm, subsequently affecting the breathing. One specific case occurred during the night shift on June 8, 2015, as Letby injected air into the tubes of a set of boy-girl twins who were both born just a day earlier, 6 weeks premature. Despite efforts to resuscitate the boy, he was pronounced dead just around 90 minutes after Letby took over the shift. The sister was able to be successfully revived, but had to stay in the hospital for weeks after to recover from Letby's attempted murder. Understandably so, the twins' parents were grieving during this process of hoping the lives of their children will be saved. Oddly, though, records show that Letby had searched Facebook on her phone of the twins' mother several times. The first shortly after finishing the shift on which she murdered the boy, and then again the night after attempting to kill his sister. She searched for the mother again 2 months later. Records show that there were also searches of other victims' parents just minutes after her unlawful and unethical actions, seemingly searching for grief. To show her unquenchable sense of power, control, and playing the victim, Letby filed a grievance against the hospital after suspicion arose that she was harming and possibly killing babies. As a result, some employees were mandated to apologize to Letby and attended mediation sessions, including Dr. Ravi Jayaram and the lead doctor, Stephen Breary. This falls in line with traits of narcissists, who oftentimes play the victim to mask insecurities and oftentimes even guilt. As a result of her neonatal murder spree, Letby would be spending the rest of her life in prison, as she was found guilty of 7 counts of murder and 7 counts of attempted murder.
This was a cruel, calculated, and cynical campaign of child murder involving the smallest and most vulnerable of children, knowing that your actions were causing significant physical suffering and would cause untold mental suffering. You created situations so that collapses or causes of collapses would not be obvious or associated with you. You removed and retained confidential records of events relating to your crimes and checked up on bereaved parents. There was a deep malevolence bordering on sadism in your actions. During the course of this trial, you have coldly denied any responsibility for your wrongdoing and sought to attribute some fault to others. You have no remorse. There are no mitigating factors. In their totality, the offences of murder and attempted murder were of exceptionally high seriousness, and just punishment, according to law, requires a whole life order. Lucy Letby, On each of the 7 offences of murder and the 7 offences of attempted murder, I sentence you to imprisonment for life. Because the seriousness of your offences is exceptionally high, I direct that the early release provisions do not apply. The order of the court, therefore, is a whole life order on each and every offence, and you will spend the rest of your life in prison.
On a post-it note, Letby wrote, "I don't deserve to live. I killed them on purpose because I'm not good enough to care for them." While she is soliciting sympathy with this and several other notes that she has written during the timeline of her murders and conviction, Lucy writing that she does not deserve to live shows that she chose to act as the role of God in the babies' lives. And now she wants to play the role of God in her own as well. What are your thoughts on the Lucy Letby case? Comment below and be sure to like, share, and subscribe. I'm Dr. Chris.